Hello friends, we are demonstrating the shoulder anchor range of Smith & Nephew company today. Smith & Nephew has got a very wide range of shoulder implants, and we'll be focusing and discussing in detail what all kinds of implants are available and what are their pros and cons. So if you talk about shoulder instability surgery, the initial anchors which were used were PEEK or biocomposite anchor. So this anchor is called as a BioRaptor anchor, and this is a PEEK material anchor, and this is used initially for instability surgery. Nowadays, shoulder instability surgeries has moved on to all suture anchor, and this is a suture fix all suture anchor. Now this anchor is available in all sorts of configuration. This is an active deployment anchor. So what that means is you have two knots. So this is a white button. When you push it, you hear a noise, and then when you pull this yellow trigger, you hear a noise. So this suture fix anchor is basically nowadays at present the gold standard of the Bankart or instability repair in the Smith & Nephew portfolio. Now this anchor is available in a single loaded and a double loaded configuration. So you can use it as per your wish. If you want to use a single loaded, it is 1.7. If you want to use a double loaded, it is 1.9. But be careful to use the same drill bit because they have the different drill bits. So whenever you push it, you put a drill inside, and then you put it inside, push the white marker, push the white button, you hear a noise, and then you pull the yellow trigger and you hear a noise, and that means that this is an active deployment anchor. What it means is, with active deployment is, you can see on the tip there is a flower which is made. So on the push of the button, the flower is made, and then it is difficult to pull it out. So this is one of the most preferred anchor as far as I am concerned in the shoulder instability repair devices. Now there is a newer version to this which will be launched, which is called as a Q-Fix anchor, and that is an anchor in which we can actually increase the size of the anchor, so it becomes a very large ball, and again the pull-out strength of the Q-Fix anchor is very strong. The principle remains the same. Now this is the Accupass. This is the passer I recommend for the Bankart. So it has got buttons on both the sides. So when we just push these buttons, you can have this wire coming out from the Bankart, and you can do all sorts of repairs. So this Accupass coming different angles, and you can use that as per your choice. Now coming to the rotator cuff portfolio. So it has got a very large rotator cuff portfolio. Initially, twin fix anchors were used, and twin fix anchor used to come with the eye. Now the eye used to be prominent, and usually it has got a poor cortical hold. So the company has modified into a twin fix ultra implant. So it has threaded up to the tip, and if you see the threads, they are coming from the interior. The threads come from deep interior of the thread. So this is very important. So the thread comes from the tip of the anchor, and this is a twin fix ultra metallic titanium implant. A new generation to this implant is a PEEK implant. So if you see, this is 5.5 mm twin fix PEEK. So this is again an anchor of my choice. PEEK is a bio-inert material. It does not have any reactions in the body. So this is again one of my preferred anchor if I am doing a single row or a double row rotator cuff repair. The third anchor in the twin fix series is a twin fix biocomposite. So this is basically an anchor which is a different material, and it is sort of absorbs and melt into the bone. So this also can be used as desired. Now the other thing is a helicoil anchor. This is a very unique anchor, and if you see this anchor, this is actually a hollow anchor. So it has an osteoinductive property. So the bone will ingrow into the anchor, and that will lead to a very, very strong fixation of the anchor with the bone. So helicoil anchor per se is a very good anchor for the rotator cuff repair, and because of its osteoinductive property, the fixation becomes strong with time. As the time progresses, the bone will ingrow into the tendon, into the anchor itself, and it will become stronger and stronger. So this helicoil series is now my treatment of choice for repairs of the rotator cuff. Now we have a helicoil knotless available, which you can use for the lateral row repair of the rotator cuff. Now for the lateral row repair, we have two options. This is a footprint anchor which was used initially. Now this has been almost replaced by a multi-fix ultra implant. So this is basically an implant which has got a straight tip, and then you have a cortical fixation screws, and you have two loops which will take two sutures each, and then you can take out these sutures from here and fix it here, here and here, and then you can rotate it actually